joining us live and to those listening in afterwards. I'd also like to warmly welcome our guest today, whom I'll shortly introduce. Our webinar today is titled, as you can see on the screen, Stress Management in Pharmacy Teams, which is a very important topic. Today is World Mental Health Day. Work-related stress elicits a variety of physiological, emotional, cognitive, and behavioral responses resulting from the demands of job content, organization, and environment. Pharmacy professionals sadly often experience tension, distress, and feelings of being overwhelmed as a result of such stressors, especially after COVID. Given the negative impact of stress on health, safety, and productivity, proactive stress management is essential for pharmacy teams. At this event, we will explore tailored stress management techniques, enhancing professionals' well-being and capacity to deliver optimal patient care. By prioritizing mental health, pharmacy teams can foster resilience and a thriving work environment. This webinar to equip yourself and your team with essential tools to meet the challenges of modern pharmacy practice. In the next slide, I would first, before introducing myself, thank Ines Nunes da Cunha and Marianne van der Bern, who are behind the scenes to make sure that everything works perfectly as it will. So my name is Jaime Acosta, Jamie, if you prefer. I'm a practicing community pharmacist and the immediate past secretary of the community pharmacy section, and also the technology advisory group of the FIP co-chair. Some very brief announcements. Please note this event will be recorded, live streamed on FIP YouTube, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through the Q&A box that you have at your disposal, and I will do my best to manage all the questions so that at the end we will be able to address those questions. You're welcome to provide feedback to webinars@fip.org. And I would like to take this opportunity to promote the benefits of membership with FIP, including events and webinars. FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. If you are a pharmacist or pharmaceutical scientist and you would like to become a member, please register on FIP's website at fip.org. I really encourage you to benefit from becoming an FIP member. Also, I would like to thank Opella, which is this event is supported by grant by them. Thank you very much. So for this event, we are joined by a panel of fabulous speakers. I have seen their slides already, and their content is very, very interesting. I'm really sure that you're going to love it. And I want to sincerely thank each of them for taking the time to prepare their presentations. Today's program, the first one is my welcome and my introduction. Then we will have Dr. Faith Young, from Australia, about common causes of strain in the pharmacy environment. Then we will have Jay Badenhorst from the UK, talking about the link between stress and overall team productivity and job satisfaction. And last but definitely not least, Kate Dunkley from Australia, talking about building resilience, effective strategies for managing stress in pharmacy teams. Then you will have the opportunity to have your questions answered. This is a privilege that you have these very knowledgeable speakers. Please don't miss the opportunity. I highly encourage you to send your questions through the Q&A box. And if you want any of our speakers to answer them, please type their name, and we will try to make the time to answer those questions. And a final wrap-up and conclusion. Today's learning objectives is to identify common stress triggers and stressors in the pharmacy profession, understand the physiological and psychological effects of stress on pharmacy team performance and job satisfaction, explore coping strategies for managing stress and learn how to manage stressors effectively, and understand how to promote a culture of sustainable work-life balance. I like this program very much. I'm actually talking from my pharmacy. And I know we all know as pharmacists what stress is like. Mental health is defined by the World Health Organization as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. Most people struggle with their mental health from time to time, whether it's brought on by stress from work, financial issues, or relationship strain. Furthermore, mental health is a component that is present to some extent in all other non-communicable diseases. As chronic diseases, they often produce anxiety or depression in patients that need to be addressed as part of a holistic and multidisciplinary approach to non-communicable disease management. As I said before, and as you probably know, today's World Mental Health Day, the overall objective of this day is to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. Today's webinar is fully in line with this year's World Mental Health Day theme. It is time to prioritize mental health in the workplace. World Mental Health Day 2024 highlights various aspects of mental health at work, including stress management at workplace. According to the World Federation for Mental Health, employed adults spend more time working than any other activity during their waking hours. Also, pharmacists, of course. In a myriad ways, and at its best, work can provide a livelihood and be a source of meaning, purpose, and joy. That's pharmacy. However, for too many people, work falls far from short of its potential, failing to enhance our lives and detracting from our mental health and well-being in ways that result in excessive distress and mental ill health. Mental health issues such as depression and anxiety are pervasive for workplaces globally, impacting productivity, attendance, and overall performance. When left untreated, the staggering economic cost is estimated at the astonishing amount of $1 trillion US dollars annually by the WHO. Today's campaign goal is clear: to champion mental health in the workplace and build best practices that create cultures where workers have the potential to contribute productively and thrive. Pharmacists can contribute to the prevention, care, and management of mental health conditions and the stigma associated with them by supporting patients through many different roles, including the health promotion and education, prevention of addictions, substance use disorder and overdose prevention, early detection, triage and referral, mental health first aid, treatment optimization. This is very important as pharmacists, helping to shape public policies, interprofessional collaborative practice, and research. Pharmacists have shown that they are very valuable assets in providing evidence-based advice to patients, supporting digital advances in the information and technologies that enable the management of mental health conditions, and be a valuable member of the healthcare team in the prevention, care, management, and management of these conditions. Not only it is important for pharmacists to address the mental health concerns of their patients, but it is equally important that we consider our own mental health and that of our pharmacy colleagues. The issue of mental health and burnout among pharmacy teams has become more widely recognized in recent years, particularly during and after the COVID-19 pandemic. Burnout has been widely documented among many different facets of the profession, and it is essential that efforts are made to address this issue. While burnout itself is not a mental health diagnosis, it can increase the risk of developing a mental illness. So this is an important issue to address. According to the WHO, burnout is an occupational phenomenon that is caused as a result of chronic stress in the workplace and is usually characterized by the following three symptoms: feelings of energy depletion or exhaustion, increased mental distance from one's job or feelings or negativism or cynicism, related to one's job and reduce professional efficacy. I think all of us as pharmacists sadly know these symptoms from time to time, hopefully the less possible. Burnout can have far-reaching implications and can affect not only the individual experiencing it, but also their patients, which is also super important. Given the consequences that burnout has on individual healthcare providers, as well as our patients, it is important to address this issue within the pharmacy profession. For more information on how to support your mental health and the mental health of our pharmacy teams, see the FIP publication Mental Healthcare, a handbook for pharmacists, and also the Knowledge and Skills Reference Guide for professional development in mental health care. I would also like to draw your attention to this report made by the community pharmacy section, in which we also have some very positive messages, as 60% of the people, of the pharmacists that were interviewed in this research expressed a strong conviction in the sustainability of the role and future potential of community pharmacy. Also, a 90% majority willing to meet evolving healthcare challenges and opportunities, but sadly, 62% of these survey respondents acknowledge burnout or other mental health concerns related to our work as pharmacists. This report also offers 6 recommendations for policy and practice. So now moving on to introduce our first speaker for today. It is my very big pleasure to introduce you to Dr. Faith R. Young. Dr. Faith is a pharmacist researcher with a keen interest in improving the quality of primary care in health systems by addressing workforce challenges, professional identity, and organizational conflicts within and between professions. She is an experienced community pharmacist and a researcher in Australian primary and tertiary care. Dr. Young, thank you very much for joining us today. The floor is yours.
Thanks so much for that lovely introduction, Han. And thank you, Ines and Marianne. Just wanted to say what an honour it is to speak to the International Pharmaceutical Federation and everyone here. To introduce myself, next slide. I've been working in multiple pharmacies since 2007 as a pharmacy student, then a pharmacist, and instead of making the leap to management, I find myself in a PhD program. So I'm not a medical doctor, the academic doctor. So my research work has been informed by that lived experience as a pharmacist, where I realized there were going to be no simple answers, because research at that time I found didn't reflect my experience of the pharmacist work system. So when I was doing my research, I ended up requiring an interdisciplinary and mixed methods approach to provide bridges between my lived experience of pharmacy practice and academia. And that became a strength in my later research, which has continued within workforce and practice research in primary care and hospital settings. And I'll be using this in grants for future pharmacy workforce research. I'm very happy for anyone to contact me if they're interested in that kind of thing. So next slide. So we know that stress is a problem in healthcare and pharmacy. It's not going away. In the background of this slide are the references on pharmacist stress from my 2018 scoping review. This is the one where we only use qualitative papers, and we had so many more. And this is just the papers from 1990 up until 2017. So we know that stress in pharmacies are not new. We know stress has been getting worse. And internationally, it's across all industries, work has become more complex. Healthcare, including pharmacy, has not been an exception. So we know that especially in developed countries, more people lived for longer with more complex healthcare needs. And that basically means we have more work to do. but we also need to help the profession manage this increased levels of stress which have happened. So before going into the common causes of stress in pharmacy, let me give you a background into some of the research. I'll try to be quick and not be too academic about it. So hopefully it'll be understandable. So basically, after the pandemic, well, we're sort of after the pandemic, the healthcare workforce, we know that it's been opting out. So they've been deciding not to work in healthcare anymore. And we see that through the retention issues and the shortages. And those whole of system issues have been exposed, and it's basically due to an under-resourcing of healthcare systems. Many healthcare clinicians, you might actually empathize with this. You might realize how undervalued sometimes by the community, by other healthcare professions, by government. And that's triggered lots of people across all healthcare workers. They've left it altogether, or they retired earlier than they expected to. So for people who are policymakers and academics who work on a system level, this is your time. We need collaborative work to fix this resourcing and undervaluation issue. In pharmacy especially, we tend to be very much in the background, and we just want to help people in the community. Not everything's documented. So it's made it even more difficult sometimes for us to really speak for our profession. So I've put in the slide here a couple of different useful approaches that help with complexity and systems thinking, because you can't take a simplistic approach to this that will just minimize all the issues, and it might take several of the more important issues. So there's a reason why mixed method, participatory, co-design approaches are now really trendy. It's because of the complexity of challenges these days. And so for researchers who are in this area, I do recommend, using a critical or constructivist paradigm. If you don't know what that means, welcome to ask questions and send me emails. That's fine. So next slide. So basically, there's too much to talk about in all of these slides. So I'm just going to be going through the most important points, and I've left some stuff there for you just to read and think about, and you can ask questions afterwards. Most of what I'm saying will relate mostly to community pharmacy. That's where most pharmacists work, but a lot of the principles can be translated to other settings. So I hope you can follow along, even if you're not in community pharmacy. So I'm going to be focusing on the actions we can take. So number one, we're going to describe stress and analyze the causes. And then we're going to look for a couple of solutions as interventions, and the things that you would have to do in research and in your own pharmacies is test and monitor those interventions and then improve upon them. So if we look on the next slide, there are these major changes happening in the health system and pharmacy work. In the pharmacy world, we're wanting to work to our full scope. And if you were to summarize it, we're going from just being about supplying medications and the things around it to providing health services. So it's more involved. It's got to be patient-centered. It's interactions that you have with the patients and with other healthcare providers, and it's outcome-based rather than only product supply. So that's a major change for the industry. We need to acknowledge that it's a major role transition, and it's a big change, yes. So if we go to the next slide, basically we can then describe the pharmacy stressors and work system. So if anyone says to you, I don't understand what you guys do, it's so complicated, this slide will give you a nice little summary. It is really complicated for a pharmacist in their work. So they've got their workplace, your individual characteristics, your professional training, there's the health workers and patients around you, and then there's your family and community roles. And this sort of explains the pharmacy work system on a wider level. And the main thing I want to bring your attention to is, when pharmacy work takes more effort than its rewards, it that's when it can result in those role strains in your bottom left. So physical illness, mental health issues, and the person being dissatisfied in their role, job, or career, and it can lead to you leaving the job or career for one with a better effort reward calculation. So it sort of explains a lot of what you might have seen. So when we can see across the world that pharmacy workers are stressed, basically it's then not about the healthcare system exactly and only, and it's not only because of, you know, a particular country. It means that basically the work system as it is doesn't reward all the services pharmacies do for patients and communities. So whilst medication supply is central to pharmacy work, it's the medication counselling and other free, unpaid, undocumented services that pharmacy staff give, which provide the whole picture of pharmacy value to communities. So if you look on the right-hand side, we've got this effort reward diagram. So when an individual is rewarded only for medication supply, but all the other services are expected to be done at the same time, then that means there's an effort reward imbalance for other pharmacy services. So the rewards are only for medication supply, and then the effort is too much for all the other services which are expected but not necessarily rewarded. So for working to the full scope of pharmacy staff training, we need to change our work systems. And I would contend that it's actually the number one cause of stress in pharmacies, because we're still trying to work like how we did 50, 60, 70 years ago. So if we jump over to the next slide, it's basically the work system we've inherited from those who were pharmacists before us, when they mostly made and compounded their own medications. They sold them with doctor involvement. I know some countries haven't separated supply and medication counselling from doctors' work. In Australia, you know, it's mandatory that all pharmacies are owned by pharmacists, and prescription-only medications are only supplied by pharmacists. Anyway, so here I've got a description, you know, if our pharmacist role was mostly doing, you know, compounding a product supply before, when we've got the newer pharmacy services now, there's too much to do. They sort of interact with each other. They don't necessarily quite speak to the same thing. And so pharmacists may be underqualified for some services and then overqualified for only doing product supply or dispensing without patient interaction. It might be boring intellectually for the pharmacist. And then you're not sure what you're supposed to do when you're implementing these new services, especially if you have a lack of resources. And so our issue with the pharmacy work system is that it hasn't kept up with the pharmacy work changes. And so many other professions and industries have had similar issues. So I looked into the research further to see what we can use for pharmacy. So we'll go to the next slide. Yeah, so looking back into the literature, they describe very similar problems with workplace stress in the 1950s as today. And they normally talk about job and career satisfaction, intention to leave, retention. A bit newer is work-life balance and role in orientation. So when it comes to theoretical approaches and research, all of those top job and career satisfaction, they're outcomes for a theory like person-environment fit. And then effort reward imbalance is probably an easier concept to use for qualitative work. And these are useful for overall concepts, and so for explaining about stress, but not very good for addressing stress. But other approaches in workplaces also to be familiar with and are useful about occupational health and safety, psychosocial hazards, human resources management, and so on. So if we jump to the next slide, there is a reason why healthcare is different to corporate workers. And I'll explain that more later, but especially in healthcare, we've got some hazards, moral injury, when people are forced to do something that's against their own personal values. There's vicarious trauma, when you're exposed to someone else's trauma, whether physically or you were told about it. And then when it comes to burnout, you know, empathy is one of the most important resources a healthcare worker can have. So, but the problem is it can be used up, especially if you, and so that's why self-care is so important. It's so important for every healthcare worker, including pharmacists, to have ongoing practices to look after themselves, especially when difficult things happen. And being in primary care, pharmacy often has you know, the violence and aggression kind of events, which can be very difficult to deal with. And I just wanted to urge everyone, if those things happen to you, don't just move on and never look back. If you need to take time, please, and if it's safe, please take some time to recover. All right. So jumping to the next slide, very generally to sort of summarize this up. So those people, those pharmacists who have less autonomy or the control of work, they're going to be more vulnerable to anxiety. And those with more professional responsibilities are going to be more vulnerable to overload. So the levels of vulnerability are different for different people in the pharmacy, according to how much autonomy they have and how much of, say, clinical responsibility they have or responsibility they have in the store. So that's why employee pharmacists especially are quite vulnerable to all the different things that can happen. And also, I wanted to present to you this idea of intersectionality, which is quite a new kind of concept, even in research. But it's basically talking about how people who are from a demographic in your community who experience more disadvantage, those things layer on in themselves. So if you're from a minority ethnicity in your nation, they don't speak the dominant language as their first language. If they're female at birth, they have less resources in their background. They're non-binary, they're migrant refugee or from a rural regional location. And if they're very empathetic kind of person, they're more likely to be more vulnerable. But what you need to know about them is they're also very likely to be a very good clinician because they can see all of these issues and they're experiencing it themselves. So they're more likely to be closer to what your community is like. I don't know if I'm going over time, but I'll try and move on. All right. So the next slide, thank you. So with all of these issues, what can we actually control? So I'm going to focus mostly on the workplace here. So stresses and experience strain, they're moderated by the role system, which is created mostly by the workplace and how they designate the job's support, roles, demands, and controls. And so the workplace, the proprietor, the business owner, the pharmacy owner, they have a large responsibility, and it's going to take our profession's culture change towards well-being for all pharmacy employees for it all to change. So rather than following corporate business advisors, which use office workers as a standard and in their organizational theory research, we need to know that they have a different way of working. So corporate usually work by breaking work down into simple tasks that don't require training, and it's repetitive. Whereas healthcare is different because it requires basic training. Each person has to be qualified as an individual with autonomy to apply, you know, the mandates and the guidelines of the profession to the patient in an individual way in the healthcare team. Thanks, Haim. So what I recommend is if you value your pharmacists and workers as individuals with specific training and insight into the communities and understanding of the patient base. So input into them and their careers, provide professional training if you can for retention. And if the pharmacy isn't working how you want it to, the pharmacy owner and leaders, they need to find what support you need to have to do your job and support the team, because you have the resources and power to do so compared to your workers. So if you're struggling, your team probably is too. So get help. Pharmacy as well, if we look at collaboration, pharmacy is part of the healthcare team too. So make connections so you work together and don't feel like you're by yourself looking after the whole community, because you probably aren't to begin with. So you might as well work together. Facilitate connections, introduce yourself and work together with the local general practitioners or family medicine doctors, optometrists, physiotherapists, or the people who are out there who are looking after your community and the hospital. Work with them. And then finally, like, make quality care the standard and reason that you're working towards. So quality person-centered care, create business plans that will enable that, so that there will be less stress for your whole pharmacy team. So when they fulfill their work, they're contributing to the sustainability of the business. That's the responsibility of the owner, really. And that can be quite difficult because it also requires health system change, but I'll talk a little bit about that later. So if we jump into the next slide, so one of the most important things we found in our research as well is that we need to customize pharmacists and other roles with the new kinds of pharmacy work we're doing. So if you're doing medication reconciliation, you're doing reviews, screening and prescribing services, you probably need to rework all your workflows, because basically services in a counseling room are not compatible with standing out in the dispensary and supervising the shop. You can't do it because you can't be in two places at once. So it requires changes, whether it's using a dispensing tech to be the one directing traffic, or basically what you need to do is make sure that the pharmacist, who is usually the only staff member who can do everything in the pharmacy, you've got to protect their time for patient care and focus them on the most important parts. And so when you do business planning for it as well, you need to understand that the newer health services, they're appointment-based, they need patient privacy, they need the counseling room. So there are different considerations, because appointments, people always cancel, they always don't turn up and things like that. So you need different kinds of business models. All right. Jumping into the next section. So when you do the interventions, after you've looked at all the support, the roles, demands, you need to control the risks for your pharmacy as well. So acknowledging what risks are out there, you want to provide and maintain a safe system of work, and you want to keep workplaces in a safe condition, free of risks to health. And I've provided like links under a lot of these, so that even if you're from another country and they are Australian resources, I believe you might still be able to use them and adapt them to your country. So it is a process all the time. You've got to identify the difficult things for your pharmacy team, address them, assess them, try and control them, and then review to see whether it's worked well. And also make sure you always talk to your team. Yeah. So it's not easy, any of this, because it's an ongoing process of improvement, but it is important because work for pharmacists is changing anyway. And it does require whole of system change, not just at the workplace level, but also and also the individual level, but also the whole health system. So we jump to the summary. Causes of pharmacy stress, they are complex and experienced more intensely by those with more responsibility but less control over their work situations. And we can make a difference in our profession's present and future if we're willing to learn from the mistakes of the past, rather than be upset about how much things have changed. Every other industry also reinvents themselves constantly. But if we're having to change, we should be doing that with quality care in mind. So not about business profits, even though that's important for sustainability. We don't, if we're only thinking about profits, we might as well be any other retailer on the street, But we need to find ways to make pharmacists work, medication quality, quality use of medication work sustainable so that they center on person-centered care rather than dividing and taking funding from other professions necessarily. Work together with the other healthcare professions to improve what we're doing. Use research and advocacy to prove what we're doing, what we're actually doing and most people don't know about, and then also prove what we're doing is important. Yeah. If we ignore that mandate and duty to care, we basically abandon our profession. And having no medication experts in the increasingly complex healthcare world is so much more stressful than the issue with retention we're dealing with now. And I believe everyone here, believes in the future of pharmacy. I do too. I think we can do the right thing. And so thank you so much for listening to my presentation.
Thank you, Dr. Zhang. I really loved your presentation. It was so relevant, at least to me. Especially, I like the slide about vulnerability and the relation with professional autonomy, because we also found that in the community pharmacy section research when comparing different practices from different countries. So I think that's super important, not only, as you said, for retention and attractiveness of the profession for young pharmacists, but also super important, of course, for our soul as pharmacists trying to fulfill our role in society. We really need to do what we have to do and allow policymakers to be aware of our potential and try to make them allowed to do our job as pharmacists. So thank you, Dr. Young. I can talk about this for hours. So thank you, Dr. Young, for your excellent presentation. And now we move on now to the second speaker for today. It is my pleasure to introduce you to Mr. Jay Badenhorst. He joined the Pharmacists Defense Association as Director of Pharmacy in May 2024. He helps lead the PDA to look after the individual and collective interests of employed and self-employed pharmacists in the UK. He has an interest in international humanitarian law and holds a master's degree in law. Mr. Badenhorst, thank you very much for being with us today. The floor is yours.
Thank you very much, Jaime, for that wonderful introduction. And Faith, what a brilliant presentation. And I feel privileged to follow after your presentation to hopefully show you what we've done in the UK in practice to try and address some of the themes that you've been discussing. And good morning, good afternoon, and good evening to all of you, wherever you are in the world. It's a beautiful, sort of sunny day in the UK where I am today, and I hope it's a really nice day where you are as well. My name is Jay Badenhorst, like Jaime said already. I'm originally from South Africa because Badenhorst isn't a typical English surname, as you can imagine. And the director of pharmacy for the Pharmacists Defence Association. And I will be referring to the Pharmacists Defence Association as the PDA during the presentation. I am a pharmacist. I've been practicing in the UK for, nearly 25 years now. And I've also recently gained my independent prescribing qualification in the UK. However, my role with the PDA involves a mix of strategic oversight, advocacy and professional leadership for the organisation, and of course, working in the PDA on a day-to-day basis as well. And it's really gives me great pleasure, and it's quite humbling to present to you today on World Mental Health Day about the link between stress, pharmacy teams, productivity, and job satisfaction. Next slide, please. In today's presentation, we're going to cover the following. I'm not going to read off the contents, but in brief, introduction to the PDA. We're going to look at some common stresses in pharmacy, the environment impacting on pharmacists' well-being. We'll also be discussing how the PDA supports pharmacists facing workplace stress, And we'll be referring to a survey used by the PDA to assess workplace stress, and that is based on the UK Health and Safety Executive Standards. We'll be briefly discussing the results from a 2023 NHS England workforce survey, which covers data on stress levels and working conditions within the community pharmacy sector, importantly in England. And we will look at specific stresses and factors that impact stress in the pharmacy workplace, reflected also in the workforce survey. And of course, we'll be demonstrating how the PDA is working to address these findings and also help to fight against stress in pharmacy workplaces. Next slide, please. So a little bit about the PDA. I can talk an awful lot about the PDA. I'm very proud working for such a forward-facing organization. But the PDA is really a multifaceted organization. We've got team members working daily still within practice, who also worked for the PDA, and they have an active role in telling us what it is really like at the sharp end of community pharmacy practice and also practice for pharmacists elsewhere. But we are also active in other organizations such as FIP and EFU, and we're really proud also to say in international movements as well, such as the Pharmacists Without Borders movement, and of course recently, as you may have seen in Cape Town, the Medicines Do initiative, the recent one, which we launched in Cape Town. In the PDA in the UK, we protect, support and advocate for pharmacists in their professional and workplace related matters. Now that sounds very, very high level, but in essence, we're a membership organisation and trade union in the UK that represents and supports pharmacists and pharmacy students. We engage with government bodies such as the Department of Health, regulators such as the General Pharmaceutical Council, who's our regulator, and other healthcare organisations to ensure that pharmacists' concerns are heard and acted upon. We, of course, influence policies by working closely with policymakers. We work very closely on a regulatory level and try to influence those as well. And also, we represent pharmacists' views on national and local levels. And this includes working on issues like staffing levels, patient safety, and professional autonomy. We are, as I said earlier, the only independent trade union exclusively for pharmacists in the UK, and we actively seek to protect their employment rights. We also actively promote equality and diversity within the pharmacy profession, and we have several networks, as you can see on the slide, to support pharmacists from different backgrounds and abilities advocating their rights and fair treatment. And today you can see I'm wearing pink. It's because it is Breast Cancer Awareness in the UK, and this is specifically working with NORC, the National Association for Women Pharmacists. Next slide, please. On the slide on display, you can see some statistics on workplace stress and mental health conditions. And this is from the most recent Health and Safety at Work survey conducted by the Health and Safety Executive for Great Britain. The data is from 2022 and 2023. And it shows the impact of workplace stress and mental health conditions in the UK workforce, and it specifically focuses on healthcare workers. In this case, it also includes social workers, so they combined healthcare and social workers. And these statistics really emphasize the increasing burden of mental health issues in workforce, particularly in the healthcare sector. One thing that stood out to me was that mental health was now the 5th most common reason for sickness absence in 2022, and that the health and social care setting faces higher rates of stress and associated conditions than any other measured setting. That's really important for us to know. Before COVID, the pandemic, 25% of people suffered poor mental health or had an episode of poor mental health. However, in our post-COVID world, this has now increased to nearly double. Just looking at the numbers of people that are on the call today is to around about 230. Statistically, that means that right now, 92 people are suffering from poor mental health in this cohort of people. 92, that is absolutely staggering. Some may have long-term conditions and others may be more short-lived. So, for example, this morning I had a lot of stress trying to get my camera working. Now, that is short-lived, but it is incredibly serious that we need to take this very seriously about people suffering post-COVID world. Now, ask yourself this: if healthcare workers are affected in this way, that they feel they've got a duty of care to patients, How will it affect their care? And how will it affect the patients and the patient outcomes when dealing with patients? Next slide, please. As healthcare workers, we know that certain biological factors can significantly contribute to poor mental health. And this influences, of course, the development of mental health conditions like stress, anxiety, and depression, and serious healthcare conditions. Now, we're not going to explore this in detail today, but you'll be aware that it includes genetic inheritance, imbalances in neurotransmitters such as serotonin and dopamine, hormonal fluctuations such as experienced during the menopause, chronic illnesses, infections, and of course, substance misuse. However, the precursors to poor mental health could affect all of us at any point of our lives. And this is called, of course, can also be an episode of poor mental health. Now, these events we do experience at some stage in our lives, such as, for example, a period of grief, a loss of a loved one, a new job, even the grief of moving from one job to another, moving house, separation, maybe from loved ones as well. Insomnia, we all suffer insomnia at times. Quite often, after a shift in a pharmacy, I'll wake up in the middle of the night thinking, did I check that appropriately? And that really affects us because that's got a knock-on effect on the following day. Of course, financial changes and financial pressure with the world economy at the moment, that affects a lot of people. And of course, we know other health-related issues. So people with long-term health conditions are more likely to suffer poor mental health as well. Now, crucially, nearly 9 out of 10 people with poor mental health also report that there are some stigma and discrimination attached with their poor mental health. And this can make their health even worse and even stop them from getting help. Now, often they face more than one type of stigma as well. So, for example, you may be stigmatized because of your race, gender, sexuality, or disability, and making life even harder for you. So the stigma and the discrimination can trap people in the cycle of illness. And it's not surprising that we see people with poor health, which includes poor mental health and disability, are among the least likely to, one, find jobs, be in a steady long-term relationship, live in decent housing, be socially included in mainstream society. And of course, we also know that those people, they don't ask for help and they don't tend to access any support. Next slide, please. How the PDA gets involved, like I said, we are multifaceted, and we have always received information from our membership through our advice lines, but in recent years, we've decided to formalize our approach a little bit more. And therefore, we launched a survey where we ask our members and member events to check on the mental well-being pulse of our members. Our first survey was launched in 2021, and initially it focused on the 3 largest community pharmacy employers where we had recognition. Excuse me. And this was extended to our whole membership, who work in all sectors of pharmacy, when we started realizing the value of the information we got from this. We then slice and dice the information, which we use for different purposes. And for example, we share the information with our membership. We use it to develop our training and education programs. And then we further influence policymakers further up in the tree as well. Alongside the survey, we also hold member events where we see people face to face and at times online. And here they can share and identify organizational, professional, sectoral, and environmental issues, which can help us with them co-create solutions that is fit for them, but also acceptable to their employers. And we have many examples that I can share with you, but due to time constraints, I'm not going to go into those examples. But if anyone wants examples of where we've had positive impact, I would be more than happy to share that with you afterwards. Next slide, please. Our survey uses the HSE, Health and Safety Executive Management Standard format. That's a bit of a mouthful, but basically it focuses on different management standards. The scale that people score is out of 5, and the lowest score indicates a more significant risk of stress caused by that particular factor. The HSE management standards are, of course, guidelines to design organizations to assess and manage workplace stress. And we adopted these because they are recognized, and it's a format that produces relevant and useful information. The standards also focus on identifying and reducing the primary causes of stress at work, which of course we know can affect employees' mental health, well-being, and ultimately performance. And addressing these 6 key areas then help organizations to foster a safer and more productive working environment, which in turn positively affects mental health and well-being and performance. It also supports other legislation and the Health and Safety at Work Act to emphasize the employer's responsibility to reduce stress and protect employee well-being. Now, you'll see that I've spoken about 6 of these standards, but under the managed standards, I've actually listed 7. And the reason why we've done that is that we have separated manager support and peer support due to the different sectors in pharmacy in the UK, because not all of our members could potentially have one support network that have manager or peer, depending on where they're employed. So, for example, a locum employee will potentially not have a manager that they can rely on support from. And of course, our respondents are from all of our members, which are detailed in the slide. And you can see that on the survey respondents, NHS, large multiple community pharmacy chains, and independent community pharmacies. Next slide, please. Now, if you recall from the slide before, a lower score indicates a more significant risk of stress caused by the factor. Therefore, when you look at the bars, the lower the bar, the higher the risk factor. On the bottom, you will see the risk factor that is measured as well, which are the standards from the slide before. Now, I'm not going to name and shame today, but the bars mean different things to us. So, for example, dark blue is the NHS combined, which combines employees and workforce from hospital, GP, and primary care, GP pharmacists working general practice. The orange line, the grey line, and the yellow line were the 3 largest multiple community pharmacy employers in the UK. You may draw your own conclusion from that. And the light blue was the supermarket pharmacy chain. And then green represents the independent community pharmacy combined, so locums and also people working in independent community pharmacy. Therefore, looking at the results, we can see that demand and change pose the highest risk compared to role, which indicated the lowest risk. Now, we have seen a lot of change happening in community pharmacy, for example, by big changes in community pharmacy ownership models. We've seen some chains disappear completely, and also some smaller chains going to larger chains. Now, just very briefly, change, of course, refers to the organizational change, such as restructuring, mergers, or changes within management. And this, we know, can significantly source and cause stress if it's not managed well. The HSE standards also assess how change is communicated and managed within organizations, and whether employees feel informed and involved during the transition of, for example, one structure to another. Next slide, please. When we looked at the NHS combined and that for community pharmacy combined, we saw similar results except for one measure, which is role. Now, when we started digging a little bit more around what that meant, is that we discovered that as part of a new scheme which was launched in 2019, which was called the Additional Role Reimbursement Scheme, or in short called the R scheme, contributed a lot to this. Now, the R scheme was brought in order to recruit pharmacists in additional roles within general practice. And as of March 2023, over 6,300 full-time equivalent pharmacists were recruited into the roles in general practice. And many of our members reported, because they moved from one sector to another, that they didn't clearly understand their roles and responsibilities when they landed in these new R's roles. So therefore, in September 23, the PDA published a report highlighting, amongst other concerns, of course, inadequate training, time pressures associated with the new roles, unacceptable workloads, and also expectations for people to work outside of the scope of practice, and also not having enough time and sufficient time, protected learning time, to train for the new roles. And, unsurprisingly, inadequate pay for our members working in general practice. However, we also were very aware that that had a huge impact on our community pharmacy cohort as well, because the biggest pool of pharmacists that they could recruit pharmacists into the new roles from was from community pharmacy. which was also, we saw the impact on that in the other measures directly associated with community pharmacy. Next slide, please. On this slide, you can see the description of the measurement of role. Now you may recall that role indicated the lowest risk, which measured whether employees clearly understood their roles and responsibilities within the organization. Now, you know that if you don't know what you're supposed to do, that ambiguity in the role or conflicting expectations can lead to confusion, frustration, and of course, stress, which in turn may be perceived as a lack of performance. Now, employees need to understand what's expected of them to perform effectively. By changing someone's role without proper guidance, training, and development, the risk of workplace stress and anxiety could quickly become very high, as we've witnessed in the NHS sector as a result of the ART scheme. Now, arguably, the pharmacists who experience this would potentially be more prone to time off because their mental health may be affected by that. And even what we have seen some trends developing is that once you are in this ART role, once you start figuring out that this is actually more difficult because you can't cope and there's not enough support, people start moving back to the sector that they came from because that's where they felt comfortable and they're able to manage their mental health better. Next slide, please. When we looked at demands, it refers to aspects such as workload, work patterns, and the work environment. Now, the HSE standards assesses whether employees feel that the demands placed on them in terms of sort of time, resource, and expectations are manageable. Now, excessive workloads, unrealistic deadlines, and high pressure can contribute to workplace stress, and that's what's reflected in this. So clearly, we still have a lot to do. And often we find that these are outside of our control because they are driven by patient expectations. Quite often we found that they are driven by senior managers chasing targets, for example. Faith also earlier meant that profit. So a lot of people are chasing profit because they want to ensure that their pharmacy can continue trading. And this may be as a result of various things. So, for example, underinvestment from the government relating to community pharmacy. Next slide, please. When we looked at stressors and aggravators, and during our member events, we became aware of certain trends and themes developing, which affected all pharmacists' productivity and job satisfaction. And arguably, this will also have a direct relation to stress and mental well-being. The culture in many pharmacy environments have shifted towards focusing on profits over people, often leaving pharmacists unsupported and disconnected from management. This may be, like I said earlier, due to years of underinvestment in the community pharmacy sector and also uncertain funding for other sectors, such as the ART scheme, which recently came into question. Of course, poor communication between senior management, head office staff who will be facing their own pressures, and pharmacists exacerbates these feelings of uncertainty and isolation. And it's not a surprise that this lack of support is then resulting in the figures we see around bullying and harassment, where we've seen 27% of people feeling that they are bullied, compared to 15% in 2021, and 46% felt that they were always subject to personal harassment. If you imagine someone constantly asking you, are you reaching that target? Are you reaching that target? So pharmacists start feeling disempowered by dictatorial management styles, which limit their control, decision-making, and autonomy. Additionally, the rising prevalence of patient violence and aggression, often linked to medicine shortages or not being able to see a healthcare professional when you want, and also linked in with racism and xenophobia, adds to stress and strain on the pharmacy team. And this creates a challenging and oft-time hostile work environment. And you know yourself, once you work in that environment, you can't cope and you just want to get out. Next slide, please. So you're asking me, so what, Jay? Well, the data collected on the workforce survey from 2023, 87% of all communities took part in that survey in England. And it started illustrating to us everything that we started discussing before. And it suggested that there was a decrease in number of qualified pharmacists of 226 and pharmacy technicians of 1,108 working community pharmacy in England. In terms of full-time equivalents, that is 1% for pharmacists and also 18% of pharmacy technicians moving out of community pharmacy elsewhere. A lot of these technicians, we know, hasn't gone from one sector to another, but have actually left pharmacy completely. And also, some of the pharmacists have left pharmacy completely to pursue something else or just leave the profession. And that's really worrying because that adds to the burden of the people that's left behind. Further, in 2023, a greater proportion of community pharmacists were now starting to work as locums rather than being employed or relief pharmacists. And this increase in locum working could also be a way that people are looking for ways to better manage their work-life balance and therefore also reduce their stress and poor mental health conditions. We've also seen that there's expectations at times from the government and some contractors or commissioners, pharmacists to do more for less, and also potentially for no pay increases. And also we have seen that demands in their expanded scope of practice are sometimes unfairly placed upon them, and they have to do learning and development in their own time. Now, very importantly, NHS England said that the insights provided by this survey was, of course, very, very helpful because they're going to use that along other employers and stakeholders to inform future investment in education and training and effective workforce planning across all pharmacy sectors. I'm not quite sure of how relevant that will be for all pharmacy sectors, which is what the PDA will be using to try and influence policymakers from then onwards. Next slide, please. So categories of concern and action. The PDA has already taken steps to contribute positively to our findings. However, our strategy for our members is that we will focus on a positive financial and mental health and well-being program. We already have support services available to our professional indemnity policyholders, and we work already with organizations like Pharmacist Support in order to provide additional support to our pharmacists. Pharmacist Support, by the way, is an independent welfare charity that supports pharmacists, their families, pre-registration trainees, and pharmacy students in the UK during times of hardship. However, we're also expanding our work to support our members more in different areas, and we've identified in our findings that we'll be focusing on the 4 themes listed on the slide. Next slide, please. I'm very proud to announce that FIP has recently endorsed our Safer Pharmacy Charter. We conduct periodic surveys of our members to assess pharmacists' experience against the 7 commitments. This data, which you can see on the screen, and this data then further supports our policy development and advocacy work. The Charter was launched in Parliament in December 2017, and it focuses on keeping patients safe primarily. And of course, safety is key to every pharmacist's role. But we also know that unsafe working conditions risk harm and patients and damaging consequences for pharmacists, such as, for example, impacting on their physical and mental health, notwithstanding regulatory scrutiny as well. Now, these 7 commitments produced by PDA members are used to improve patient safety and care through better working conditions in UK pharmacy practice. And of course, this supports positive mental health and well-being agendas. We will continue working with employers and other bodies to support our Safer Pharmacy Charter, which defines the basic standards to ensure safe practice wherever a pharmacist works. So it's not limited to community pharmacy. Next slide, please. And lastly, and by no means least, as the pharmacist leadership body in the UK, we are committed to continuing to use our integrated approaches to address workplace concerns while focusing on successful outcomes. We will continue using our focus to facilitate a collaborative journey for our members and allowing them to engage with our goals. It will make them feel invested in the process and also part of any changes happening. We will continue building our Safer Pharmacy Charter, and when required, we will expand its scope to include proactive actions and activities which will ensure its relevance and longevity remains key. To enhance visibility and engagement, the PDA will continue developing materials of fact sheets and posters and case studies that are designed for easy understanding, which will encourage external stakeholders and buy-in. And all of these support and fact sheets and posters are available on our website. And finally, our education program will run alongside existing projects to deliver quick wins and tangible benefits to members and promote a culture of safety and well-being in pharmacy workplaces. By combining these strategies, we will create a supportive environment, and we are creating a supportive environment that prioritizes pharmacists' needs, improve overall workplace conditions, and make time to prioritize mental health in the workplace. Next slide, please. I know we're not going to look at questions right now, but if you do have any questions on the presentation, scan the barcode, get in touch with me via email, and I believe we'll have time for questions and answers afterwards. Thank you very much for listening and for your attention. Back to you, Jaime.
Thank you, Mr. Barnhart. It was an excellent presentation and also very, very informative and very relevant. I was thinking about the COVID-19 pandemic at which the profession shined. And I think we can be very proud we saved the day, but of course we paid our price. Also me personally in my family life, because I mean, it was incredible. So thank you, Mr. Barnhorst. So it's time now to move on to our next speaker, Kay Dunkley from Australia. She is passionate about the health and well-being of health professionals. After forging a career based in hospital pharmacy, Kay has over the years been involved in roles providing services which support pharmacists and other health professionals, including the medical profession. Currently, Kay is employed as the Executive Officer of the Pharmacists Support Service, PSS. Kay, thank you also for being with us today. The floor is yours. Thank you very much.
Thank you very much for that lovely introduction, and I would like to thank FIP for hosting this webinar this evening and congratulate the other two speakers on their excellent presentations. I will be really honing in on practical strategies that we can implement in our workplaces by working with our teams to manage stress. First, so that's just who I am. And first of all, I'm just changing the slides. Oops, I've gone too far. I just want to acknowledge the traditional owners of the lands on which we live in Australia, because our traditional owners actually are the ones who were the original inhabitants of Australia. And I am on land that's owned by the Bunurong people and of the Kulin Nation. So I'd like to acknowledge our traditional owners and the lands on which we're meeting today and pay my respects to elders past, present and emerging. And I extend that respect to any Aboriginal and Torres Strait Islander people who are joining us today. So a little bit about the Pharmacist Support Service first of all. Sorry, I'm having a little bit of trouble with my slide moving on. We are a charity, a not-for-profit charity, similar to the Pharmacist Support in the UK, but much smaller. We are pharmacists supporting pharmacists. We have a phone line that's available every day of the year that people can call. It's anonymous, it's confidential, and they're speaking directly to a volunteer who is a pharmacist or a retired pharmacist. We train all those volunteers, and it's very much a crisis model of counselling, with our aim being to empower anyone who calls us. And it's available to all Australian pharmacists, interns, pharmacy students, and any international pharmacy graduates who are living in Australia. So that service has existed since 1995 and became national, and we would average more than one call a day, but we're not inundated because there are lots of other sources for support. Our organisation sits independently, but we also have many other pharmacy organisations such as a pharmacy union and membership organisations such as the Pharmaceutical Society. So people have a range of places they can go for support, and hopefully they can also turn to those around them. So just to define resilience, because it's one of those words that people sometimes find a little bit difficult. It's very much our ability to recover or adjust easily to misfortune or change. Now, it can be weaponized. Sometimes people will say to you, you're just not resilient enough. You know, you're not coping with the workload because you're not resilient. And I really resist that. I feel that resilience is not necessarily an individual trait. It really refers to our workplaces and our teams. And I think, you know, we have to be careful how we apply the word resilience, because, you know, it is something we can develop. It's not something we're naturally born with. And a few things that it's not about being tough or hardened by our experiences. It's not about denying the stress and saying, I'm okay when we're not okay. And it's not about denying our emotions or withholding the expression or acknowledgement of emotions. And it's not about withholding empathy or compassion. And it certainly doesn't overcome all hardship or difficulties in life. And it doesn't mean we never fail, and it doesn't make us superior. However, resilience is the ability to adapt. It's something we can all learn and develop. We need to have a growth mindset, which means we need to believe we can change. It's very much a lifelong endeavour, and it's developed through an awareness and acknowledgement of our emotions. We need to be tuned into ourselves. And, you know, it's important that it enables us to actually show empathy and compassion to others. And it is very much enabled by our social supports and being connected to others. And it enables us to be honest and vulnerable. You know, being resilient is not denying the problems. It is about being vulnerable, admitting there are problems. And being resilient is also a sign of good teamwork. And I think that, you know, it's really important to remember that we're all part of teams. We may be in a large pharmacy or a pharmacy department where we're working as part of a team, but even in our small pharmacies where we may be just working with 1 or 2 staff members, we're part of a healthcare team. And I think that, you know, we need to remember that, and we need to actually be engaged with that team, and the team needs to support us and we need to support our team members. Now the slide, here we go. And just a reminder that teams together, everyone achieves more. So I think that's an important concept with teams, that, you know, when we work together, we will achieve more, we will be less stressed, and we will cope better. And that, you know, teams are more productive and more efficient. So what are resilient teams? Well, they're very much psychologically safe. We don't fear being criticised or put down if we raise an issue. They're also kind. A resilient team members are kind to each other. We encourage and support each other. We do give honest feedback, and we enable all the team members to grow and improve by giving that honest feedback. But we accept and respect the differences. Everyone in our team brings unique skills and experience, and it doesn't matter where they are in the hierarchy, whether it's someone who's unpacking the deliveries right through to the chief pharmacist. We need to respect that everyone has an important role, and there is, you know, an equality in terms of the value of each member of the team. Now, the other important thing is listening to each other and remembering that we all have 2 ears and 1 mouth, and that if we listen to our colleagues, we may actually be able to resolve problems and issues that arise, because by having that open dialogue, it enables us to hear what everyone has to say and work together to, you know, manage a difficult situation. The other thing that teams do, resilient teams do, is work collaboratively, and they cooperate. So they actually work side by side, helping each other. Teams must have a leader. Now, a leader's not the same as a manager. A leader is someone who naturally leads, who has that authority to direct others, but the leader needs to focus on the needs of the team, not themselves. So a leader shouldn't be focusing on their own well-being beyond the team. They need to actually look at how the team works together. And the team also needs to have a common vision and aim, so that when we're working together in a pharmacy, under pressure, we all know what our roles are, and we're more efficient and effective. We have better outcomes when we do that. And we're also more sustainable. And this sustainability is important. It's come up in both Faith's presentation, also Jay's presentation, that, you know, it's really important that pharmacists can remain well and in the workplace because of the staff shortages that will occur. And the less staff we have, the more likely we are to find difficulty responding to demands. So having these resilient teams is really key solution to, you know, being able to work together and solve problems and manage the demands that we face on a day-to-day basis. So how do we build a resilient team? And these are just very practical strategies. And I mentioned leadership, and skills of leadership can be learned and developed. It's about putting aside ego and looking after all members of the team. And there are ways to, you know, develop your leadership skills. There's a lot of training and coaching and mentoring available. And as I said, it's not the same as management. So it's not doing a management course. It's actually participating in leadership courses or leadership coaching. There are many natural leaders, but we can all improve and develop our leadership skills. Now, as individuals, we also need to nurture a positive view and respect ourselves by looking after our well-being. Now, I don't mean, when I say a positive view, I don't mean that false positivity where we say everything's okay when it's not. What I mean is actually knowing that we have the power to manage our own well-being. And there's some very basic things we can do. You know, our self-care should be part of our everyday life, and it should involve the very basics of diet, healthy diet, exercise, sleep, our own hygiene and appearance, activities which bring us joy, and taking time out from our work to do those things, to nurture ourselves. That social connection, both within the workplace and outside the workplace. Being aware of our own emotions and managing them through self-compassion and self-care. So being tuned into what you're feeling and acknowledging that self-compassion is so critical to us being able to manage the difficult times, because if we try and ignore how we're feeling, ultimately we will become burnt out and we won't be able to continue our work. So we need to, you know, work on ourselves as well as being part of a team. And we need to keep learning and developing. That is, you know, learning new knowledge and new practices and taking up new skills is also self-care, because it gives us new challenges which we enjoy. We also need to practice gratitude and be grateful for whether it's our team members that we have work, and think about what was good. Yes, there were lots of bad things, but also remember that there were some good things. Now, I'm not talking about that false positivity. I'm saying, you know, realistically, at the end of every day, we can review and reflect what went well and what didn't go so well, and be grateful for the things that went well, but also reflect on how we could change the things that didn't go so well. So it's getting that balance and acknowledging that not everything's bad because one thing went wrong. Now, the other thing that's really important in teams is knowing who everybody is, know who each person is, what their skills are, and when they need extra support, what things they need to, you know, where they need to develop extra skills to be able to do their job. Because if everyone is aware of what each other is good at, when we're under pressure, we can tap into individuals' expertise or individual skills. We need to build those relationships by checking in with each other. That "are you okay?" which is, you know, a day we have where we ask everyone, "Are you okay?" That needs to be every day. We need to actually be meeting regularly, have lunch with our team members, or having a team huddle to check in at the start and the end of each day, a good handover, social times together, celebrate events such as birthdays or special occasions or public holidays or seasons. You know, building those relationships with each other mean that when we're under pressure and under stress, we can actually work together better because we know each other and we know who the other people are. everyone in the team needs to have a clear role and responsibility with a fair workload. And this came up in both Jay's talk and Faith's talk, that, you know, this unclear role definition is quite a stressor. So part of the teamwork and part of being, you know, being able to overcome difficulties is knowing what everybody's role is and where they fit, and having that clear levels of responsibility and fair share of the work, and being willing to help each other and encourage each other. You know, when someone's got through a difficult time, saying, well done, that was really good. You know, when you're all working together to perhaps handle a busy workload, a big increase in demand, you know, encouraging each other and you know, working together. Be open about difficulties. And I think it's really important that leaders actually acknowledge that things are hard, but be positive with a growth mindset. That is an attitude that things can change, and trust in the strength of the team. I mean, having a team around you immediately takes the pressure off you as an individual, because you're working together. And I think the other aspect of building resilient teams is that teaching, training, coaching, mentoring, peer support, so that all the team members are growing and developing. You know, and these things about building a resilient team, obviously employers and others have responsibilities to provide safe workplaces, to look at occupational health and safety, to look at workloads and fair remuneration. But if we work together as a team, that's something we can control ourselves, and that will actually improve the quality of our work life, and also, you know, make us more effective and efficient. So managing challenges. So when there is a challenge, say there's a huge rush of prescriptions coming in the door of the pharmacy, leaders need to know what each team member's capability is, and use that to the best advantage. So you may have someone at the front counter who's really good at greeting people who are coming in. You've got a rush of people all at once, making sure that that frontline team member actually gives realistic expectations about waiting times for prescriptions and manages that. And you also need that open and honest communication, both with the members of the public who you might be serving, but within the team as well, so that if someone seems to be, you know, not contributing to the team, you can actually call them in and say, look, come on, let's all work together on this. And being respectful and kind always in our communication is so important. It actually brings the best out in people. And maximising resources. So, you know, it is important that we call for assistance. We have a plan, have a backup, prioritise need and urgency. So if you are having a big demand for, say, dispensing of prescriptions or services, you know, maybe there's a rush of prescriptions, but also people have come in to be vaccinated, knowing how to prioritise that, knowing what needs to be done first and what can wait till later. And this again is where you can have a team member who's assigned to that role. And then, you know, I keep coming back to this encouragement, acknowledgement and small rewards, you know, and when the team has got through a difficult time, having something like, whether it's sharing a coffee or snacks, just acknowledging everyone's contribution. And just some photos to lighten up the text. These are some examples of a team huddle, you know, a small team that might be part of a bigger team getting together and having a handover, sharing a coffee over the break, and having some snacks for those busy times. Because often, you know, pharmacists go without, they miss out on having their breaks, and so having some healthy snacks that people can, you know, keep themselves, build their energy with, and having someone who'll go out and get the coffees when you're under the pump, so that everyone can stay, you know, nourished and keep up their energy levels. I think, you know, these are just some examples of the sorts of well-being things that you can implement in your pharmacy team. So I mentioned huddles. After trauma, and we do sometimes have trauma in the pharmacy. I mean, it can be something like a violent incident in the pharmacy or a hold up. It can also be just that a long-term patient has passed away and you're feeling quite shocked, or someone that you've been helping with their mental health has, died by suicide. There is that trauma in our work. We are dealing with life and death. I mean, there's also positive times when someone comes in and shows you photos of their grandchildren or their pet or something like that. But, we have people that we build relationships with, and when things happen to them, it can be traumatic, as well as also, whether we have a difficult situation, perhaps a bad encounter with an aggressive patient, or a doctor who's difficult over the telephone. And I think, it's important to debrief with each other. Sometimes when something's quite serious and we may need to get some professional assistance with a counsellor or a psychologist, but a lot of that support can be done through our peers and by taking time as a group to reflect with each other. And I think the other thing in terms of, managing challenges is that feedback and discussion, review after an event. So you've had a really busy day in the pharmacy and you can look at what went well, what didn't go so well, what needs to be changed, what could we do differently next time. And again, that's about cooperating, collaborating, listening to everybody's ideas and suggestions. So just to summarise, building resilient teams, it's an ongoing process. It does take effort and it takes strong leadership. We all need to work on our own well-being and self-care. We need that respect and trust within the team. When we're part of a resilient team, there's a lot less stress. I know that from my own experience in pharmacy that, if you've got a good team working together, you don't feel as stressed when everybody's collaborating and helping. And, as healthcare professionals, we can provide better care and better outcomes if we're part of a resilient team. I have put some further reading, just some general references here that you might like to look at if you want to think more about resilient teams and building them. A lot of the references are actually broader than just pharmacy, and that's because, there are others who work in this area. I mean, we as pharmacists, we're similar to a lot of other health professionals in terms of our teamwork. But also, within any workplace, there are teams, and it is important that, all teams, wherever the workplace, work on resiliency. And I think there are, some other people who've been looking at this for longer than we have as pharmacists. And so we can learn from some of these sort of other, research models in other professions. So that's it from me. I'm happy to take questions and I'll hand back to Haim.
Thank you, Kay, for a very realistic and practical presentation. I liked especially the slide where you said what resilience is not. We many times think we have superpowers, and sadly we do not have them. So thank you for your presentation. I'm very sorry to say that we do not have time for live questions. Our speakers were very, very kind to answer the questions that were put into the Q&A tool in writing. So in the interest of time and not to be late, which I think is my major role as moderator, I think we need to skip the live questions. Thank you for your understanding. So in the next slide, just a quick wrap up from me. Thank you to the three speakers. Your presentations have been wonderful. And it's very clear that the evolving economic, professional practice and workplace pressures need to be addressed. It is critical for all community, for all pharmacy workplaces to be supported with evidence-based strategies as presented today that can be adapted to foster positive mental health and well-being. Thank you to FIP for doing this webinar today, which is very timely. By the way, one of my pharmacists yesterday brought a coffee machine, so it's a very good opportunity to do some informal meetups with the team. And thank you for bringing it up, Kate. So just some quick reminders from the FIP. In the next slide, just a reminder that the recording of this episode will be made available on fip.org website. Please provide your feedback to webinars@fip.org so FIP may continue to improve their digital event offerings. Visit events.fip.org for all future events. Also, reminder announcement of the coming World Congress of Pharmacy and Pharmaceutical Sciences conference in Copenhagen, Denmark, next August and September. It's a must-do event if you're interested in pharmacy, and it's also a very powerful networking event. It's not only very important for updating yourself, but also for meeting colleagues that are changing the professional worldwide. These are the sub-themes that we're going to have in that conference in the next slide. Making it sustainable, making the system work, and making it personal. The important dates, 17th of March, the abstract submission deadline, the 2nd of June, early registration fee deadline, and the 11th of August, the second registration deadline. You have more information about the conference at the Copenhagen 2025.fip.org. So this is all from us. One last thanks for your attendance, and to our brilliant speakers. Thank you very much for taking the time for sharing your knowledge. And see you soon. That's it. Bye-bye.